Patient-centered approach to care, for me, means care planning. That means setting up 2 consultations for the patient. One where data is gathered from the patient, and then all the data, blood pressure and blood test results and everything are sent to the patient before their care planning consultation. It enables the patient to own their results and to have an intelligent conversation with their doctor or nurse. The benefits of sharing results a week or 2 before the patients come for a consultation are enormous. Patients receive their results, they talk about it with their family, they Google it on the internet, and when they come to a consultation with me or our practice nurse, they understand what their results are. And after all, they are their results, they're not mine.
Patient-centred care very much revolves around knowing your patients, understanding them, knowing where they're coming from and how they like to receive their care, whether it would help them to actually have their results beforehand, or whether there's somebody who just wants to come in and talk about it. A patient can come in with a set of problems. They'll be completely different from what I may have. So I need to hear what they're saying if I want them to hear what I'm saying, and then we need to work together as a partnership. That way we've got a hope of actually making some progress. Approach patient-centred care by, when the patient comes in, listening to them, asking them what are their issues, what are their problems, what do they think they can do about it, before we start looking at what I've got on my agenda.
People only spend an hour or 2 a year in front of their doctor or nurse, and the rest of the time they're on their own. So if they don't learn how to self-care, they're really stuck. So this whole idea of doctors and nurses knowing best has to go, and patients have to step up to the plate and take responsibility for their own conditions. How do we encourage engagement and self-care in people with diabetes? 2 things. First of all, it's about patients owning their results. So that means getting them before they come for a consultation with the doctor or nurse. Secondly, it's about the doctor or nurse treating the patient as an expert in their own condition and respecting the circumstances that they have and the knowledge that they have, and working together with that person rather than just telling them what to do.